Welcome everybody to our next webinar for SynGAP Research Fund. We're really excited to continue our SRF webinar series. The goals of our series are getting families closer to the science, making families aware of the research that has been done and opportunities to participate, empowering communications with our clinicians, and equipping families to advocate for the needs of your loved one with SynGAP 1. We want to share with you our next webinar, which will take place next Thursday, May 13th at 10 a.m. Pacific time. This will be with Dr. Kurt Haas and is entitled Functional Assessment of Missense Variants of SynGAP 1. You can sign up for all of our future webinars and view past presentations at syngapresearchfund.org. Today's talk is entitled Let Me Hear Your Voice, Affecting Change Through Effective Advocacy, and is presented to us by Lorri Unumb, Esquire, the CEO of the Council of Autism Service Providers. Lorri's career in law began at the University of South Carolina, where she earned degrees magna cum laude in broadcasting and political science, and was awarded a full scholarship to USC Law School, where she graduated with honors. Lorri's advocacy in autism was inspired by her personal experience of being a mother to a child with autism, as her oldest of 3 sons, Ryan, has autism. In 2005, she wrote the groundbreaking autism insurance legislation for South Carolina, known as Ryan's Law, that passed in 2007 and served as the catalyst for the national movement towards autism insurance reform. Following the passing of Ryan's Law, Lorri worked at Autism Speaks, where she served for more than a decade as Vice President for State Government Affairs. She oversaw advocacy initiatives in all 50 states and was responsible for spearheading the autism insurance reform movement, which led to 49 states requiring meaningful health insurance benefits for autism, including applied behavior analysis coverage. In 2019, she became the CEO of the Council of Autism Service Providers, which advocates for best practices in autism services. These are just a few highlights in Lorri's long and celebrated career. In addition, she has founded the Unumb Center for Neurodevelopment, which provides services to people with autism in South Carolina. She and her husband, Dan, wrote the first ever comprehensive textbook on legal issues related to autism entitled Autism and the Law, and she has won numerous awards for her contributions to autism advocacy. We could not be more thrilled to have such a high impact speaker here with us today. About 50% of people who receive a SynGAP 1 diagnosis will also receive a co-diagnosis of autism spectrum disorder. Lorri has spoken with SynGAP Research Fund advocates in the past about advocating for proper treatment of our loved ones and is aware of the unique challenges we face as a community. At the end of the presentation, you will have an opportunity to ask your questions by writing them in the chat. A recording will be made available on the SRF website. Again, welcome to our presentation today entitled Let Me Hear Your Voice, Affecting Change Through Effective Advocacy. So Lorri, I'm going to hand it over to you, and thanks so much again for being here.
Perfect, Sydney. Thank you so much for that kind introduction. And can you just let me know that you do see my slide and everything is good?
I see your slides and we hear you just fine.
Perfect. Thank you so much. And thank you to the SynGAP Research Fund for the invitation to speak to you today. I really enjoyed talking with some of the leaders from your organization a couple of months ago, and there indeed are so many similarities between the struggles that you face in getting effective services for your children with the autism community. So I want to start at the very beginning of my talk. It's going to be a little bit duplicative of the information that Sydney just shared with you, but I kind of want to share that I really come at this from 5 different perspectives, and I'll share those with you now. First of all, professional perspective. My work, my full-time career is in autism now. I spent a decade with Autism Speaks, and then as Sydney said, I now lead the Council of Autism Service Providers. And I'll talk a little bit more about those professional experiences as we go. But I share that the first of my 5 perspectives is this is my career, my professional perspective. Secondly, although I'm not a provider, I do have a little bit of provider perspective because my husband and I founded a nonprofit clinic, originally called the Autism Academy of South Carolina. As Sydney shared, it's now called the Unumb Center for Neurodevelopment. The board very kindly voted to change the name in our honor just a couple of years ago. And I share this even though I don't work at the Unumb Center, and I never have. I do still feel responsible as the founder of the organization, and it has helped me understand from a business perspective the provider aspect of things. I feel responsible to make sure that our staff get paid every 2 weeks, and we're almost at 50 staff now. So it has certainly shaped my advocacy to have a little bit of insight into the business and provider side of things. So that's the second perspective. The third is an academic one. I taught a law school course for about 5 years called Autism and the Law at George Washington University Law School, where I used to be a full-time professor before autism entered my life. And as Sydney also mentioned, my husband and I wrote a textbook to go along with that course, also called Autism and the Law. And so approaching all of these issues about access to care, funding, lifelong care, from an academic perspective has also shaped my advocacy. Fourth, I just wanted to share that I spent a couple of years as a commissioner on the South Carolina Department of Disabilities and Special Needs. South Carolina is my home state and where I currently live. And this gave me, again, a whole new perspective. The Department of Disabilities and Special Needs is the state agency in South Carolina that administers Medicaid waivers for people with disabilities. And so it certainly broadened my perspective to understand a variety of disabilities and a lifetime of needs and limited resources. I stepped down off of that commission just last year at the end of my term, but I learned an awful lot. And again, another perspective that shapes my advocacy. And then finally, the fifth and most important perspective, of course, is that of parent. And my son, my firstborn, was diagnosed with autism at 22 months of age. At the time he was diagnosed, I really didn't even know what autism was. I had seen Rain Man, and that was about it. What I learned, just, I'm sure you all know this, I learned from the doctors that day that autism was not considered curable, was considered treatable to some extent. All the facts, 4 times more common in boys than girls, medical condition brought on through no fault of the family, literally learning from scratch, just like any other parent, all of that on the day of my son's diagnosis. We were living in Washington, D.C. at the time he was diagnosed, when he was born and at the time of his diagnosis. And I look back on that and think how lucky we were to have access to multiple very fine medical institutions. And he, in fact, was triple diagnosed because I was on the waiting list for so long trying to get an appointment with a developmental pediatrician. And by the time I had waited 6 months for an appointment, I just went ahead and kept all 3 of them, even though he was diagnosed at the first one. And looking back, I think that's really lucky because all 3 of these excellent institutions recommended the same course of treatment for my son, Ryan. They all recommended that he be enrolled in a very intensive regime of applied behavior analysis, or ABA. Again, something I had never heard of. I didn't even really have a concept what therapy was. And I learned, I researched, thank goodness for Google, although Google was barely around at that time when my son was diagnosed. But I learned this is a one-on-one therapy. It might be recommended up to 40 hours per week, which it was for my son because he was very severely impaired. I learned about the science behind it. And then I brought prospective therapists into our home to teach us how it works and what it costs. And what we learned is that there are multiple tiers of providers in a child's ABA program. There's a consultant at the top who's board certified, and then perhaps a mid-level supervisor or lead therapist, and then line therapists or behavior technicians at the lower level, who are the ones in your home or in the clinic providing implementing the therapy program, typically in 3-hour shifts was what they explained to me, for up to 40 hours. And then I learned about the cost. And with those multiple tiers of the consultant and the mid-level supervisor and the line therapist, at 40 hours per week, which had been recommended, it was going to cost $70,000 per year. And I remember turning to my husband in the living room and saying, well, thank goodness we have health insurance. What would you do if you didn't have health insurance? Little did I know at that time that health insurance would not cover one penny of it. And I did not understand why. Being the, I guess, somewhat cantankerous lawyer that I am, we went ahead and started treatment for our child, paying privately. And I said, well, let's push it. Let's find out why the insurance company isn't covering this treatment that my son's doctor recommended. And we would get different reasons why it wasn't covered. Sometimes they would say, well, that treatment that you want us to cover is experimental or ineffective. And I thought, really? What does experimental mean to you? Because I knew that the United States Surgeon General had said 30 years of research demonstrates the efficacy of applied behavioral methods in reducing inappropriate behavior and in increasing communication, learning, and appropriate social behavior. That doesn't sound experimental to me. If several years before my son's diagnosis, the Surgeon General had endorsed it and says it's supported by 30 years of research. So that basis for denial just didn't ring true for me. Sometimes they would say, well, we don't make insurance pay for any treatment that's provided by a non-licensed provider. Well, that one rang a little more true. I mean, there does have to be some level of fidelity and integrity in who's being paid for services. But I thought, wait a minute, that's not really fair, because it's not that I'm choosing to use a non-licensed provider when there are licensed ones. There weren't any licenses for behavior analysts at that time. And so just because the state had not seen fit yet to license that provider type, that didn't seem like a good justification to be able to deny the care to me. And yet that was the case. And particularly where in the case of applied behavior analysis, the providers were nationally board certified. It's not like it was just any Tom, Dick, or Harry off the street. Even at that time, there was the National Nonprofit Behavior Analyst Certification Board that had very stringent standards, degree requirements, coursework requirements, supervised experience, and a psychometrically valid exam that has a relatively low pass rate, actually. So the providers were qualified, if not licensed. And again, that didn't seem like an appropriate basis to deny coverage. And of course, now we know that 31 states at this point now have adopted licensure for behavior analysts. So that reason wouldn't hold water anymore these days anyway in the majority of states. Sometimes they would say, well, those treatments that you want us to cover, those are really educational in nature. That's not medical care. And, that was a little more difficult to deal with as an argument, because it is true that good schools would utilize the principles of applied behavior analysis in educating children with autism. But it wasn't true that the schools, I felt that the schools should not be charged with ameliorating all of the effects of my child's condition. The schools are charged with educating my child. And it's not fair to dump on the schools the additional responsibility for ameliorating his symptoms to the maximum extent possible. That's why I buy health insurance, because insurance is responsible for that. And for goodness sakes, my child was not diagnosed by the school principal. He was diagnosed by a doctor. So that also seemed like a bogus justification for denying coverage to me. So despite all of these invalid, in my opinion, justifications for denying his coverage, his care, I look back at that period and I think, we were among the lucky ones, because during all this period of trying to figure out why there was no coverage for autism and for applied behavior analysis in particular, my son was getting treatment. He was getting 40 hours a week of treatment because my husband and I are both lawyers. We both had good jobs. We both worked full time, and we were able to live on his salary and use my entire salary to pay for his therapy. And, even for us, with two good jobs, we had to make sacrifices. We sold our house and moved to a less expensive house so that we could continue Ryan in the level of therapy that his doctors had recommended. But I thought about all the average families in the United States who couldn't possibly make those kinds of sacrifices or afford the therapy. If you don't have two professional working parents, or maybe you don't have a house to sell, you live in an apartment, or, just the majority of families, I realized, would not be as fortunate as we were and would not be able to afford this therapy for their child. And that just seemed wrong to me, and frankly was really a knife in my stomach. I kept thinking about, what must it feel like to be a mom or a dad and know there's a treatment out there that undeniably would help your child, but you can't get it for your child because you're not rich enough. And I just couldn't sleep at night thinking how horrible that must feel. And it also just seems so unfair to me because, these are families who are paying for health insurance, right? I mean, most of the families I was working with, they're paying premiums every month, and it seemed they weren't getting the benefit of the bargain. So, motivated by my experience with Ryan and inspired by the old Schoolhouse Rock, I don't know if you all are old enough to remember, but there was a Schoolhouse Rock cartoon that came on Saturday morning, like a little commercial. And one of them was about how a bill becomes a law. I'm just a bill. Yeah, I'm only a bill. And I'm sitting here on Capitol Hill. And so it talked about, how does a bill get started? Well, a citizen has an idea and they take it to their legislator, and that's how it starts. And I remember watching that one time and thinking, hey, I have an idea. I have a really good idea. I think health insurance ought to pay for autism treatment, including ABA, as recommended by a physician. So, yeah, but I forgot to listen to the line in the song that said, but it's not easy becoming a law, because my little idea was not so simple to implement. But I sat down at my kitchen table in 2005 and just sketched out what I thought the law should be. Very simple bill, 2 paragraphs that basically just said a health insurance plan. This is in South Carolina again, where we were living. We had moved back from Washington, D.C. A health insurance plan must pay for treatment as prescribed by the doctor in accordance with the treatment plan. And that was basically it. And the coverage, the insurers couldn't impose different deductibles or copays or whatever than they impose on physical illness generally. So very simple idea, very simple bill. I contacted a legislator and got him to, I went and met with him, educated him about my family's issues and what the autism community was facing generally, and he agreed to file the bill. That began a very long journey that was at times a kick battle and at times a roller coaster ride, and definitely more than I was expecting. And the very beginning, January 12th of 2006, you can see it right there on the picture, was the very first committee hearing on that bill. I literally had never even been to a legislative committee hearing by that time. And I was in charge of putting together the witnesses and the parents and whatnot. Of course, I had been to law school, so I had some sense of how to do it. But again, not really sure if we were doing the right thing. And that really kicked off the journey, which involved an awful lot of opposition from the insurance industry. They had all kinds of objections to this little simple bill that I thought was such a good idea. And I'm not going to go through all of the, it's a long story to go through the whole battle to get that passed. But I will tell you that during the first year, 2006, we did not succeed. And instead, well, the bill actually did pass, but by the time it passed, all of my language had been taken out and had been replaced with a different program, creating a new government program funded by Medicaid, called the Pervasive Developmental Disorder Medicaid Program. And this passed into law. It set up a program in South Carolina to fund ABA therapy for children with autism between the ages of 3 and 11, funded at up to $50,000 per year, limited to 3 years of treatment. It was funded by $7 million, which meant that all of the children with autism basically put their names into a hat, and the state of South Carolina had a lottery. They drew 100 names out of the hat, and those 100 children started into ABA therapy. My child was number, I think it was like 326 when they drew the names. This program was engineered by the insurance industry as a way to defeat the bill. And they're very savvy, very smart. They figured out that they should come up with something. And so they came up with this program and really thought that the insurance parents would go away and would be happy with this. I felt very strongly that healthcare shouldn't be doled out in a lottery system. And so I said, thank you very much for this Medicaid funded program. Now let's come back the next year and pass the private insurance mandate so that the children who don't have private health insurance will be able to tap into this PDD waiver program. And the children who do have private health insurance will tap into their health insurance. And that way that $7 million will go a lot longer and serve more children. So we started all over again in 2007. And again, I don't want to share the whole story because it would take forever, but at the end of the legislative session, right near the end, on May 25th, 2007, the bill passed through the South Carolina legislature. Now, that's not quite the end of the story, because on the penultimate day of the session, the governor of South Carolina vetoed the bill. The governor in South Carolina has the option of signing a bill, vetoing a bill, or letting it become law without acting on it. And I really thought he might do that latter option. I suspected he was not in favor of the bill, but I thought he would let it become law, knowing that the autism community had worked so hard for 2 years to get this passed. But no, he vetoed it late at night, the night before the session ended. That telephone that you see on the screen is there because I stayed up that night calling my autism friends from around the state saying, oh my gosh, you're not going to believe it. Everything we just worked for is down the tubes. The governor just vetoed it. And I said, please come to the Capitol tomorrow. Show up at the State House. I know it's late at night. I know you don't have a babysitter. Just bring your kids, whatever. Let's just show up tomorrow morning and plead. Is there anything they can do? Can they override this veto? Would they override this veto? You know, politics it's such a partisan environment, and we had a Republican governor and a Republican legislature, and I wasn't sure that the Republican legislature, even though they had come to understand our issues, I wasn't sure that they would go so far as to override a veto by a fellow Republican governor. But they did. So on the very last day of the session, June 7th, 2007, the South Carolina legislature unanimously overrode the governor's veto, and Ryan's law became law. Oh, choking me up just a little bit to think about it, because it was quite an emotional day. By the time it passed, it still didn't resemble very much the actual bill that I had written initially. There were all kinds of restrictions in it. So You had to be diagnosed by age 8. Coverage only extended through age 16. There was a $50,000 per year cap on behavioral therapy, all of which I was adamantly opposed to. But one of the things I learned during this process is that you have to negotiate. If you insist on the perfect legislation, you're probably going to get nothing. So that was June 7th, 2007. And by the way, this was the next day, June 8th. I literally threw my boys into the minivan and drove to Disney World because I was so tired of being in the political arena and lobbying for this bill. And I felt like I had been ignoring my own kids. So we took off and got away from it all for a couple of days at Disney World. That led to a complete career change for me. Everything that I've described thus far, I did as a volunteer, just as a mom. I did not work in autism yet at that point. But shortly after Ryan's Law passed in South Carolina, I got a call from Autism Speaks, which had been formed just a few years before. And they said, you know, we think that's a really good law that you passed down in South Carolina. We'd like for you to come work for us full time and try to replicate that law, lead the effort to replicate that law in all 50 states. And I actually had to think about it for a few months because I really was enjoying my job practicing law at the time. But I decided I would take them up on that offer. And so I went to work full time for Autism Speaks in 2008 and led their state government affairs department. And what I did during that time was, in fact, travel around the country, meeting with autism parents and providers and other stakeholders, going to find legislators that we thought we could educate about the issue and would be sympathetic to our issue, drafting the bills for the state to consider. And every state, of course, made changes to shape it and make it their own, but we could provide a starting point for them with model legislation tailored to the state. So it was a very interesting, rewarding, gratifying journey to travel around to all the states and work on this effort to ensure that all kids have access, all people have access. I forgot I had transition music in there. So you probably have heard that we were successful in that journey, and I'll show you. I start the journey actually in 2001, not only because that's the year my son was born, 2001, but that was actually the first year that any state mandated autism insurance coverage. Indiana was actually the first, not South Carolina. And Indiana was quite out front of every other state because Congressman Dan Burton's grandchild was diagnosed with autism. I think it was his grandchild. And so, you know, I think he went through the same thing that we went through. He was shocked that health insurance wouldn't pay for the treatment recommended by the doctor for autism. And he had a brother that was still in the state legislature in Indiana. So they passed a similar bill and just required that health insurance cover autism. It didn't, I think it's significant that the effort in Indiana was backed by a congressman because it didn't generate the same controversy and debate for 2 years that was generated in South Carolina. And as a result, it didn't really catch on. Other people around the country didn't know that that bill had passed, didn't know that there was coverage in Indiana. And in fact, I have many friends in Indiana now who tell me that it actually, the coverage really did not unfurl properly as a result of that 2001 legislation. It took years before there really was coverage, and families had to fight through the Department of Insurance to get it properly implemented. I imagine the Burton family probably got their coverage, but there was not really widespread coverage for autism through health insurance for many years. So even though Indiana was first, nobody knew about it, and thus other states didn't really pursue it. So this is what the map looked like in 2001. Here's 2002, 2003, 2004, 2005. One time I was showing this at a live presentation and a mom in the back of the room raised her hand and said, "Excuse me, your picture is not changing." I said, "I know, that's exactly the problem. The picture is not changing because there was no progress whatsoever on meaningful autism insurance reform for years." This is 2006. And then in 2007, when South Carolina passed Ryan's Law, as I said, it was heavily debated and controversial, and the media covered it. And so people around the country did hear about it and became interested and said, "Hey, we want to do that in our state. We want to do it in our state." So Texas passed a very similar law shortly thereafter. Texas's law actually only covered children between the ages of 3 and 5, believe it or not. So that was dipping their toe in. Texas went back and fixed that, so it's now much more comprehensive, but the original law that passed in Texas was very limited. But so as of 2007, then 3 states had passed laws requiring insurance coverage for autism. Whoops, I went the wrong way. 2007 again. 2008, that's when Autism Speaks got involved and professionally supported this effort. And so in 2008, 5 more states passed similar legislation for a total of 8. And then in 2009, 7 more states passed bills for a total of 15. 2010, 8 more states, all in that year, it was a very tiring year, passed autism insurance bills for a total of 23. In 2011, we got up to 29 with 6 more states passing mandates. In 2012, we reached 32 states. 2013, 34 states. 2014, 38 states. 2015, 43. 2016, 44. 2017, 46. 2018, 48. And then finally in 2019, the 50th state addressed the issue. Tennessee was number 50. My colleagues and I at Autism Speaks, we would always take bets through the years of who was going to be number 50. But they all got there. They finally all got there. Now, I will say that really the map should look more 50 shades of green, because some of the state laws are much better than others. There are many gaps in coverage. There are caps on coverage that shouldn't be there, but there is at least some coverage in every state now. We actually, that green state map we would keep on the wall to keep track of our progress, but internally we had a green state grid that more granularly depicted which states had coverage and in which markets was the coverage applicable. This grid is a couple years old, but you know, you had to check, was it applicable for large group plans, small group plans, individual plans, state employees, etc. So, and for years, I kept a chart like this, looking to see whether applied behavior analysis coverage was subject to a dollar cap in a state, and was it subject to an age cap in a state. Many of those caps have now been invalidated. Some of them have been legislatively removed. Others have been invalidated under federal mental health parity law. But it's certainly an indication that the coverage was spotty from the beginning. Every state did a phenomenal job getting legislation through, but in almost every state, it wasn't perfect from the get-go. Additionally, even reaching the 50th state with autism insurance mandates didn't ensure that everybody had coverage. There are a variety of sources of health insurance coverage in the United States. Some people, see this big blue piece of the pie, have health insurance coverage through Medicaid, which is generally federally regulated. And so the state insurance mandates that we were passing don't apply to Medicaid. Some people have insurance through Medicare. Generally, that was not relevant for us because we were mostly looking at a young population, and Medicare is for elderly. Some people are uninsured, and certainly an autism insurance mandate couldn't do anything to reach people who were uninsured. I think this number, it shows 11% when I first made this pie chart, and I think that's gone down now as a result of the Affordable Care Act. But still, there is a certain percentage of the population that does not have health insurance. The purple piece of the pie at the bottom represents state employees. And these numbers, these percentages vary from state to state, but in every state, there will be a similar pie chart. And state employees also aren't subject generally to an autism insurance mandate or any other kind of state insurance mandate. Now, most of the states that pass the autism insurance mandates applied the coverage mandate also to state employees, but it was a separate effort to make that happen. The big piece of the pie here is what I have labeled ERISA or ASO, which stands for Administrative Service Only. And that is 25% of the population. That's pretty standard in a state to see 25% of the overall population insured through a plan, a health insurance plan that's governed by a federal law called ERISA rather than by state law. And technically, I said it's a health insurance plan. Technically, it's not an insurance plan because these types of plans are operated by big corporations like Walmart or Walgreens or BMW or CVS or pretty much any large corporation in America pools their own money together and creates their own little health plan for their employees rather than farming out the risk to an insurance company like Cigna or Aetna or Blue Cross. Now, you might not know if you have a health plan that is technically a self-funded plan by one of these large companies, because those large companies typically contract with an insurance company, Cigna or Aetna or Blue Cross, for administrative services only. So if you're an employee of one of those companies, you still have a Blue Cross card or a United Healthcare card, and you may not be aware that Blue Cross is only administering the plan. They're not assuming the financial risk of the plan. That's all very technically detailed, but my reason for telling you all this, the point is people who have healthcare through a self-funded plan that is merely administered by an insurance company, all those people do not get the benefit of state insurance mandates. So that big chunk of people also wasn't helped by the state autism mandates. And then just to finish out the pie here, about 2% of the population in my state was TRICARE, military families, and TRICARE, of course, is a federal program, so it's not regulated by a state insurance law. Same thing for the federal civilian workers. They have federal FEHB, it's called, Federal Employees Health Benefit Plan, and they're not subject to state law. So the remaining pieces of pie are the ones who have what I call regular insurance that the state mandate can reach. And that's still many, many people. And of course, it's very important to those people that these laws passed, but it left a lot of people uncovered as well. So as we at Autism Speaks worked on the effort to ensure that everybody who needed care had access to care, passing the health insurance mandates in all 50 states was a heck of a job, but it was only one piece of the effort. We also worked to convince the self-funded health plans to add coverage for autism and ABA. And then we had to work on Medicaid to also include coverage for ABA. So I'll say just a little bit about both of those efforts here. As I said, essentially every large corporation in America has a self-funded, internally funded health plan not subject to state insurance regulation. And so we could pass state laws all day long and none of these companies would have to comply. So the way to get these companies to have to cover autism and ABA would be either to pass a federal mandate or to go company by company and meet with the HR department and try to convince them that they should offer this coverage. And we opted for the latter. I mean, we did draft a federal bill and we had some conversations with Congress about it. But the fact of the matter is that the United States Congress at that time had only ever mandated 4 benefits in the history of the United States. So not that we shy away from a challenge, but the chances were not good that we were going to drive through an autism mandate in short order. We decided instead, it'll probably be faster to just go company by company. And we put out a call to families and said, hey, if you work for Starbucks, if you work for Bank of America, if you work for Walmart and you need this coverage and you don't have it, reach out to us. We'll partner with you and go to your HR and plead for coverage. And it's not, plead is not the right word. We'll make a business case for coverage. It's all about dollars and cents. And you might wonder, why would any corporation voluntarily add this coverage, which is not inexpensive? But they do because they have to remain competitive. And if you work for Bank of America and your child needs a treatment that's costing you $70,000 a year and Bank of America won't offer that, but your state employee plan does offer it, or another fully funded plan does offer it in your state, chances are you're probably going to leave Bank of America and you're going to find a job where your health plan, your insurance does cover it. These large self-funded companies, they know that. They know they have to remain competitive in their benefits package. It's part of compensation. And so while it was a very long process and still not complete process of trying to convince each company to add the coverage, in some ways it wasn't as difficult as you might think at the outset. I actually, every year for many years, I would compile a list and on January 1 or at the end of each year, I would say, okay, here are the new companies that came on board this year. And I'm sure I probably didn't know of all of them, but some of these companies I had met with individually. So we would know who was coming on board. All right, so we've talked about the efforts to go state by state to pass autism insurance mandates. We've talked about the efforts to go company by company to get self-funded health plans to add appropriate benefits. That still leaves the Medicaid population. And for Medicaid, we utilized a provision of Medicaid law called EPSDT. That stands for Early and Periodic Screening, Diagnosis, and Treatment. And this is a provision of federal Medicaid law that is designed to assure that children on Medicaid between the ages of 0 and 21 receive early detection and care so that health problems are averted or diagnosed and treated as early as possible. I remember the first time I learned about the EPSDT program, and I was at a conference, I believe in Washington, D.C., and the Deputy Surgeon General was speaking about EPSDT. And he said, you know, we're carrying out Congress's intent that for every kind of health problem, there should be early and periodic screening for a health problem, diagnosis of the problem, and treatment of the problem for whatever ails these children who are on Medicaid. And I went up to him at the end of the speech and I said, I just want to make sure I understand what you just said. For any health problem, there's supposed to be screening, diagnosis, and treatment paid for by Medicaid. And he said, that's correct, as long as the children are eligible for Medicaid. And I said, and that includes autism? And he said, yeah. I mean, I don't think he had thought about that one way or the other, but autism's a health problem, so yes. And I said, because I'm pretty sure that in every state or virtually every state, a child on Medicaid can get periodically screened for autism and can get Medicaid to pay for a diagnosis of autism. But we're missing the T. We're missing the T. Medicaid is not paying for the most commonly prescribed treatment for autism. He didn't have an answer to that. I'm sure he didn't know anything about it. Probably hadn't ever dealt with it before. And so that plagued me for a while, that there was no T for autism. Now, I want to spend a minute to actually read a piece of the law to you, because as I think about SynGAP and how you can advocate to get better coverage for the care that you need, I think this EPSDT program could be part of your strategy. And perhaps you've already pursued this, so let me know if that's the case. But the Medicaid statute requires certain types of medical assistance, that's the term of art, to be covered. One is paragraph A, nursing facility services. Paragraph B, early and periodic screening, diagnostic, and treatment services as defined in subsection R for individuals who are eligible under the plan and are under the age of 21. So that is the EPSDT statutory provision. And then if you look at subsection R, it says that EPSDT services include such other necessary healthcare, diagnostic services, treatment, and other measures described in subsection A to correct or ameliorate defects and physical and mental illnesses and conditions discovered by the screening services, whether or not such services are covered under the state plan. So this is an incredibly comprehensive program that Congress passed with the intent that for children who are on Medicaid, we want the government to pay to detect their healthcare problems, get them properly diagnosed, and treat them. And it doesn't list out certain healthcare conditions. It just says healthcare conditions. And so this is just a sweeping statute that I believe you could argue and successfully argue that if a doctor is recommending ABA or whatever the doctor is recommending for an individual with SynGAP, if that person is, or that child, because EPSDT only goes through 21, if that child is eligible for Medicaid, then Medicaid must pay for that treatment. And we can talk more at the end if you have particular questions about that. But it's an incredibly important tool in the advocacy toolbox. I'm debating if I was going to tell you the history. I'll take just a second to tell you that the reason Congress passed this law was because I think it was during the Vietnam War era draft, too many young people were getting out of military service on the basis of a relatively minor health problem. And Congress got upset and said, that's ridiculous. If we had known you had a hearing deficiency, we could have fixed that. Or if we had known you had this impairment, we could have fixed that. And so kind of as a backlash against all these people getting out of military, young people getting out of military service, Congress added this EPSDT program to the Medicaid program and said, we're fixing it from now on. We want healthy kids. So use it, use it. So the autism community had to do quite a bit of deliberate advocacy to make use of EPSDT. In fact, all or almost all states were not providing coverage for ABA as part of EPSDT. And so we advocated directly with CMS for a period of years. And the end of the story is that on July 7th, 2014, CMS issued a memo, a 7-page memo to all state Medicaid agencies, basically clarifying that Medicaid coverage for children with autism should include all medically necessary services. They stopped short of saying, hey, states, you must cover ABA, because they don't like to list out particular treatments. But that was the point of this memo. Almost all states instantly got it and implemented ABA coverage. There are actually 2 states still dragging their heels, even though this memo came out in 2014, and a couple of states have required litigation, but we're almost there in ensuring that all Medicaid eligible kids in all states have access to ABA. By the way, in case you're not familiar with Medicaid eligibility, it does vary from state to state. In all states, children can be eligible for Medicaid on the basis of income. If they meet a certain poverty level or their family meets a certain poverty level, that is one pathway to Medicaid eligibility. But in many states, the majority of states, there's another pathway to Medicaid eligibility on the basis of disability. And so you don't have to be poor. You can simply meet the Medicaid definition of disability and become eligible for Medicaid. So for example, my son is on Medicaid. He also has private health insurance through my job, but he is on Medicaid and he is eligible for it because autism qualifies as a disability for Medicaid purposes. So I recommend that you use Medicaid EPSDT, again, as a tool in your advocacy, even if it only reaches poor children, because strategically there's a reason to do that, but also know that in many states, it doesn't reach only poor children. It reaches those with qualifying disabilities. Okay. One thing I'm transitioning a bit here, and one thing I want to say is that I do have a firm belief that a variety of systems have a role to play in ensuring adequate services are provided to children with autism and other disabilities. I have spent most of my career, as you've heard, ensuring that insurance and Medicaid are at the table playing a role, because they were playing no role at all when my son was diagnosed. But it's not that I think the schools don't also have a role to play. They certainly do. And IDEA makes that clear. And various other state programs as well have a role to play. There's my transition cue. So I want to turn now, and for the remainder of my time, just talk about tips and strategy. If you decide to pursue a legislative route, trying to mandate coverage for SynGAP, I certainly think you could do that. And frankly, you could probably tag onto the autism insurance mandates in many states. So I just want to talk a little bit about the strategy that we developed through the autism insurance, through the period of getting all those laws passed, because I do think this is hugely important and a reason that so many advocacy efforts fail. So, okay, I forgot I had that much music. First of all, it's just really important to keep in mind, if you're pushing an insurance mandate of any sort, you are playing against the big boys. I knew that, and yet I was still overwhelmed by the amount of money that was spent to oppose our bills in each state. On our side, occasionally we were able to fund a lobbyist. In most states not, but occasionally we were, sometimes who were working well below their dollar value, but parents were doing most of the advocacy. And on the opposition side, there would be teams of lobbyists who spent every day at the state capitol working against our bill. It is kind of stunning to appreciate the extent to which you will be outnumbered and overpowered and outspent by the opposition if you're advocating against the health insurance industry. So we had a strategy in South Carolina that my brother, who has since passed away, but he was a political consultant. He didn't lay this out in the way that I'm going to tell you, but he's the one who helped me understand what's important. The strategy is called favors, fishnets, and facts. And when I first wrote this bill and I wanted to get it passed, I literally showed up with binders full of data that I had compiled to support the efficacy of applied behavior analysis and show the scientific literature. And my brother, with whom I shared this, just laughed and laughed. And he said, data? What, you think they want to see your data? They don't want to see data. Here's what you need to do. Call up your own legislator and say, Senator Jones, I live in your district and I want to ask you a favor. I have a child with autism. There's a bill pending that would really help my family. Would you sign on to that bill and would you support that to help my family? And my brother said, that's all you need to do. Just ask them. If they know that there's a constituent in their district who cares about their bill, most likely they're going to sign on to it. And I was dumbfounded by that. I said to my brother, why would anybody sign on to the bill if they haven't read it, if they don't know if it's a good idea, if they haven't seen the science behind it? He said, trust me, it's just the way it works. So that was our strategy. And within a few weeks, we had 81 legislators listed as co-sponsors signed on to our bill just by finding a constituent in their district to call and ask a favor. It was really clever. The insurance industry took note once they saw suddenly, oh my goodness, there's a mandate bill with 81 sponsors, we better pay attention. The second piece of the strategy is called fishnets. And this is not me in the photo. This is my friend Lisa Rollins, who was also an autism mom. And she decided, I'm going to do this with you. You tell me when to show up. I'm going to meet you at the South Carolina State House every day, and we're going to work this. And Lisa, she had never been to the state capitol either, but she really got into it and she was having fun and she loved getting to know the legislators. She would chase them into the men's room door, just lobbying and educating them. And I tell you, as the days went on, Lisa's skirts got shorter and the blouse got lower cut. And one day she showed up and she had on this short black skirt and fishnets. And I thought, oh my gosh, I'm going to have to tell Lisa, that's just not appropriate. And then I said, no, I'm not going to do that. I'm not going to tell her that's not appropriate. Lisa is not a professional lobbyist. She's a mom and she's entitled to come to the State House and talk to her representatives wearing whatever she wants to wear. It doesn't matter because we're not trying to pretend to be anything other than what we are. Well, that was the best decision I ever made because Lisa looked very good in her fishnets and she got a lot of doors open with those long legs. And then facts is at the end. So favors, fishnets, facts. At the end of the process, there will be one or two people in the legislature who do want to see your binder with all the facts and the data. And I was relieved, frankly, that there was. The way the legislatures work is that somebody educates themselves enough to assure their colleagues, yes, this is good policy, this is a good bill, but it's not everybody. The bulk of the people who vote on it, I shouldn't say they've never read it, maybe they have read it, but they certainly haven't studied up. They trust each other. They find somebody who has studied up and they vote on the basis of that recommendation. So that was kind of our strategy there. A few tips for legislative success that we learned as we went through the process. One, of course, is just get to know your state legislators. If you don't already know them, just call them up and say, hey, I live in your district. Those are the key words. And I'd like to sit down with you and talk with you about an issue. It's really important, even before you have an ask, to educate them on the issue. Also get to know your state regulators, because a lot of times it's the regulators who run the agencies who have more direct power over you than the legislators themselves. And I have listed just a variety of agencies from California that were relevant in our California efforts, and they have different names in every state, of course. How do you get to know your state officials, the legislators or the regulators? Be on the lookout for town meetings and go to their own town meeting if they've set something up. Definitely if it's campaign season, they'll always lend you an ear at a campaign event. There are conferences where if you're engaged in a national strategy on a state-by-state basis like we were, it's really worth your time to go to the National Conference of State Legislators or the Council of State Governments or the National Governors Association. Presumably those will start to be in person again soon. And I started going to those. I got Autism Speaks to set up a booth. I got the behavior analyst to set up a booth, because you can hit a lot of the legislators all at one time. And if you're not there educating them about your cause, why do you think they're ever going to know about it or learn about it? You've got to take that on. That's your role as a citizen in government. That's how it operates. We also set up a bunch of Starbucks meetings when the legislators were home, not at the state capitol, but home in their district. It was just really easy to say, you know, I'd like to meet with you, or I've got a handful of families who want to meet with you. Can you just stop by Starbucks on Tuesday morning at 10? And that was really a low pressure way for legislators to meet, because it's a public place. They could duck out whenever they needed to. And so we found that they were really willing to just meet at Starbucks and learn about our issues. This is the most important tip, I think, of all, and that is be friendly and polite, not demanding. So many people walk into a legislator's office and bang their fist on the desk, and they're mad because there's no coverage for autism, and why should my child be discriminated against, and we had to sell our house, and whoa, you know, 99% chance the legislator knew nothing about that, unless they happen to have autism in their family or they have SynGAP in their family. Chances are they barely know what it is. They've never heard of the treatment. They're not aware that insurance doesn't cover it. They don't know the struggles you've had as a family. You need to walk into every meeting assuming that that legislator wants to help you. They truly want to help you. They just don't know what your needs are. They don't know your issues. So your job, again, as a citizen in this form of government, is to meet with them and educate them. Here's what SynGAP is. Here's how it affects my child. Here's how it affects our whole family. Here are the problems that we're still facing when we try to access care for our child. Here's a solution that I have in mind that I'd like your help with. They respond so much better to polite, friendly approaches. If you do pursue legislation, even if it's just amending an existing law like the autism insurance law, you want to carefully choose a legislative champion. You need to find one person or a couple of people who are going to make it their job to wake up and think about that bill every day, because just getting a bill filed means nothing. The bill will just sit there. You have to have an advocate who is pushing your bill through the system. And you want to think carefully about whether you're in a Republican-controlled legislature or a Democrat-controlled legislature. You typically want to select somebody from the majority party, even if you feel like your issue is a Democratic issue. Say, if you're in a Republican-controlled legislature, find a Republican sponsor. You're going to be a lot more successful that way. Also, if you can find a legislative leader to carry your bill, they usually are savvy and have favors that they can call in. So that's always good. When you're recruiting legislators to sponsor your bill, you have to know their language. Here's what we learned. If you ask a legislator, will you sign on to the autism insurance bill? If they say yes, they mean yes. If they say no, they mean no. But most of them don't want to say no. So they'll say maybe. And if they say maybe, that means no. If they say, let me think about it, that means no. If they say, I'd like to study it, that means no. If they say, I'm not sure about the timing of this bill, that means no. If they say, I support kids with autism, that means no. What you have to understand as you're counting votes and you're counting how many people said they will co-sponsor your bill or vote for your bill, if they have responded with anything other than yes, that means no. Because if they are going to sponsor it or they are going to commit to voting to it, they really want to say yes to you. You're a constituent. They desperately want to be able to say yes. So if they say anything else, they're not with you. So make sure you don't count those as yeses. Oh yeah, I'd like to help everyone with autism. I learned also that means no. Make sure you pursue one thing at a time legislatively. So many times I would go into a state that was ready to pursue autism insurance reform. And also there would be autism advocates in the community who wanted to pursue a license plate. Oh, we've always wanted to have an autism license plate in this state. And maybe they wanted to pursue a registry. We're interested in having individuals with autism on a voluntary registry, both of which are great ideas, right? But the way legislators think, if in 1 year they do something for autism, autism is checked off. They're not going to do everything you ask for. And so if you ask for an autism insurance mandate and a license plate and the other one all at one time, a registry, guess which one they're going to do? Probably the license plate. They're not going to do the insurance mandate, which is the hard one to pass. So if you're trying to get insurance coverage, that is your only ask that year. Educate, and educate on a surface level. I'm going to quickly show you this video. It's still just kind of stunning sometimes to think about some of the people who are our elected representatives and their thoughts on insurance and how it works. Let's see if I can bring this up.
The second one is take off the mandates for coverage in the state of Nevada and all over the United States. But here, you know what I'm talking about. You're paying for things that you don't even need. They just passed, the latest one is everything that they want to throw at us now is covered under autism. So that's a mandate that you have to pay for. How about maternity leave? I'm not going to have any more babies, but I sure get to pay for it on my insurance. Those are the kinds of things that we want to get rid of.
I probably shouldn't make any comment after I show this video, but it's stunning to me that some people don't seem to understand how insurance works, and that is you spread the risk amongst the entire population. You don't just select, oh, I'm going to have babies, so I want maternity coverage in my policy, or I have a child with autism. Everybody pays for everything. That's kind of the whole concept behind insurance. So you have to educate at a very surface level, and along those lines as well. This was a huge mistake I made when I started the legislative advocacy. Legislators would ask me, I knew they would ask me, well, what is autism? And this slide was in my original PowerPoint. When they would ask, what is autism? This is the slide I would show. This is a terrible slide for that question. You can't process all of that. It's way too much information. This is from the DSM at the time. So after a year or two, I learned to simplify even more. Autism is a medical condition. It affects social skills, language, whatever. And then I simplified it even more and made it colorful because, you know, 1 minute legislators are learning about autism, and the next minute they're talking about trash collection, and the next minute they're talking about bridge construction or transportation issues. They're generalists, and they just can't remember and can't process really deep, detailed information. So you have to educate them at a very surface level. Let's see. Where is my, why? There we go. Use positive reinforcement. Those of you who are familiar with applied behavior analysis know that that's one of the principles of human behavior that's very much a part of ABA. And you need to use it with the legislators as well, and with the families who are working with you. Write thank you notes whenever you've had a positive conversation with the legislator. Issue a press release to the local newspaper. They love that. I mean, first of all, a local newspaper will publish anything that you write and give to them pretty much. And if you send it with a picture of here I am, or here's my child with Senator Jones, well, Senator Jones is going to love that. And you just put a little caption, Senator Jones showing his support for kids with autism. At that point, you've basically trapped Senator Jones into voting for you, because you've thanked him in the paper. And also be really positive with the other families that are working with you on that. It's really important to be present if you're trying to pass legislation. That's hard when you're family members. We can't be at the state capitol all the time. We have kids to care for. And so if you can hire a lobbyist, that's where that helps. But be present or be there sounds kind of obvious, but it's amazing how quickly some things happen and without notice. It's not like they call you and say, next Thursday, we're going to consider your bill. It may be that one morning the chairman says, let's put that bill on our 11 o'clock calendar, and you don't even have time to get there. So you need to be there all the time when the legislature is in session. Somebody has to be there. Keep your eye on the clock. The game is not really about yes or no votes. Typically, if somebody's trying to defeat your bill, it's about beating the clock. And so there are all kinds of internal deadlines. And if you don't get a bill passed by X date, then it gets carried over to the next year. So you haven't lost. They just defeated you with timing. And I had to learn that the hard way a couple of times. So remember, it's about the clock. Name your bill, and you have to think about whether to use the word mandate. I mean, if you are trying to require insurers to cover something, then you are mandating coverage, and technically that's called a mandate. But a lot of Republicans hate that word, and they pride themselves that they've never voted for a mandate, which I actually find to be hard to believe, because virtually all laws are mandates. Wear a seatbelt is a mandate. Drive 65 or under is a mandate. But they hate insurance mandates. Many conservatives do. So you have to think about using that language too much. In South Carolina, as you heard, the bill was called Ryan's Law after my son. In Montana, it was called Brandon's Bill, because I worked with a mom named Laura, whose son Brandon was there advocating. In Arizona, it's called Stephen's Law. So if you can name your bill and help people understand it by putting a face with it, that's always good. Orchestrate your testimony. I can see we've only got 15 minutes left, so I'm rushing through a few of these, but do not just, if you get a hearing on a bill, you do not just put out a sign-up list and say who wants to testify, because what will happen is 13 parents will stand up and say the same thing. Instead, you put out a list and you make a list of here are the points I want to make. Autism is a medical diagnosis. Who's the best person to make that point? Autism is treatable. Who's the best person to make that point? Autism is often treated with a treatment called applied behavior analysis. Here's what ABA is. Who is the best person to make that point? So you have to list out all of your bullets, all your points in the sequential order you want them made, and then decide who is the best person to make each point. It's really important to come together to the legislature. Let's see, we'll have a moment. Musical interlude moment. I don't know how the SynGAP community is. The autism community is very fractured. And if, you've got people who want to focus on research, others who want to focus on treatment. some people who want to look at the genetic underpinnings, some people who want to focus on environmental causes, in particular vaccines, some people who want to focus on biomedical treatment options. Let me turn that off if I can. There we go. Others want to focus on therapeutic treatment options, focusing on children only versus focusing on adults. Some people who say, I have autism and I don't need or want to be cured or treated at all. If you expose all of this internal division and dissension to the legislature, you can forget it. You need to go with one unified voice. And if you can't get it together internally before you approach the legislature, you're not ready to pursue legislative action in terms of getting treatment for your kids. Yes, it's very overwhelming for the legislators to understand all of that. Okay, recruit top-notch speakers. I kind of touched on that. Think of who is the best speaker on each point that you want to make and ask for their assistance. Pack the room. It's always good to show that there are a lot of people who support this bill. Whenever we had a hearing, my mother, who was in her 80s, would invite her entire Sunday school class. Half of them didn't know why they were there in the hearing room, and they didn't care. All they knew was that my mother had told them they would play bingo afterwards if they would sit through an entire hearing. And so you want to have all the people wearing your pin or wearing your ribbon or whatever that you can. Play the kid card. You know, we decided it's really not about sympathy. It's not about generating sympathy for your cause. It's about demonstrating why, from a business or from a financial perspective, it makes sense to require health insurance to cover your child's treatment. And there is a financial case to be made. That's what persuades them. It's not evoking sympathy. So we made a decision. We're not going to try to play the kid card. On the other hand, we're not going to try to hide our kids either. A lot of us needed to bring our kids to the Capitol, or else because we had no babysitters. So we didn't play that card, but we exposed them in a natural way. I was afraid to involve the media at the outset because, having been a journalism undergrad, I knew that the media was supposed to present both sides, and I really didn't want both sides presented in the media. But that was a mistake. I learned early on that was a mistake because the media very favorably covered our side, and they loved this grassroots effort that was led by parents, not led by lobbyists. So we got really favorable coverage. Always maintain your credibility. A lot of times I was asked questions by legislators that I did not know the answer to. For example, simple questions like, how many children in South Carolina have autism? I didn't have that data. I knew the prevalence statistics from the CDC. I knew some school statistics, but I really didn't have an accurate answer. Don't make it up. I mean, this is one thing you learn in law school. Don't ever make it up, because then you've lost your credibility. It's always fine to say, we've had a hard time producing that answer, or can I try to research that further and get back to you? Lower your standards. One of the things you learn in law school, they tell you there are two things that you never want to witness being made: sausage and the law. And it's really true. The process of watching a law be made is ugly. And if you insist on a perfect bill with all of the terms that you wrote into it, you're probably going to get nothing. There are probably going to be some things written into the bill that you vehemently disagree with. There were for me in virtually every state. But I had to learn to lower my standards. Some coverage is better than no coverage, even if the coverage is not perfect. It drives me crazy to this day that the South Carolina law name for my son says you have to be diagnosed by age 8, because some people don't get diagnosed by age 8, particularly in a lower socioeconomic status. So I hate that provision. But had I stood my ground and said, no, if you won't take that out, I'd rather you not pass it at all, there would have been many, many children who wouldn't have had coverage to this day. Negotiate. This was another mistake I made. This picture is the lobbyist for Blue Cross Blue Shield asking to meet with me at the end of our first very successful hearing. And at that point, I was kind of like, I don't think so. We just had 200 people in the committee room and we have a lot of support. That was a huge mistake. Always sit down with the other side and try to work out compromises and negotiate. Just say no to task forces and working groups. Very often at a committee hearing, if you've got a bill, an autism insurance mandate or your insurance mandate, a legislator will say, you know, this is a really interesting issue that I haven't known about before today. And I think it's important we do something on this. I think we should put together a task force to study this. The first time one of them said that to me, I was like, yes, we should. I think so too. And then I learned what that actually means is let's kick it down the road for 2 to 3 years. It'll take 6 months to assemble the task force and then 6 months for them to start meeting and then 6 months to write the report. No, you want action. You don't want more study. Work with a lawyer. I've got just one particular example. Georgia actually passed an autism insurance bill of sorts in 2001, very early on. This is the law. If you read the very last sentence, it says, the provisions of this subsection shall not expand the type or scope of treatment beyond that is authorized for any other diagnosed neurological disorder. I'm pretty sure the insurance industry got that last sentence inserted, and whoever was backing the bill probably wasn't working with a lawyer who could look at that sentence and say, wait a minute, this kind of negates everything. If they're not using ABA currently for other neurological disorders, then this sentence says that they don't have to use it, cover it for autism. So this bill essentially got nothing for the autism community. They worked hard to get it passed and then they didn't get what they needed. Keep your chin up. I'm not going to tell all my war stories, but the legislative route is very difficult. And if you don't have to use that approach in order to get coverage for your kids, then don't, because it's can be costly, it's exhausting. All of these bullets are stories. One of the insurance lobbyists reported me to the bar, trying to get my bar license taken away. A lobbyist at one point with a room full of autism mothers said, you know, what is autism really anyway? Isn't it something the mothers did while they were pregnant, like drinking or smoking? I mean, it's hard when you have to face that kind of ignorance and try to fight for your child's health care. It's a hard battle. Prepare for the questions you least want to answer. We actually already touched on most of these, so I'm not going to go through these slides. Let me see if there's anything else. We talked about the educational argument and the experimental earlier in the program. Yeah, but anticipate what the questions are going to be and come up with answers in advance, because you're going to be asked the hard questions. If all of this policy and legal stuff is interesting to you, I invite you to join the autism community at an event that we do every fall, a gathering called the Autism Law Summit. It's something that I started in Charleston, South Carolina 15 years ago, and it still happens every fall. We move it around the country. It was in Salt Lake City and DC, Nashville, Mobile, Albuquerque, San Diego, San Antonio. Jackson Hole was our last in-person one. Last year, we did it on Zoom and called it the Sorta Summit. But every year, this just group of autism parents and providers and researchers and policymakers come together to share ideas and strategize about how we can make things better. How can we use law and policy and legislation and court to bring things better? A group of attorneys assemble as part of it every year. These are attorneys from all around the country who are willing to litigate cases. I bet they'd be willing to litigate some SynGAP cases for you. So the Autism Law Summit this year is in Columbia, South Carolina, my hometown, October 21st through the 24th. And you would be very welcome there. and would enjoy networking with the movers and shakers who come to this. I think I'm going to jump right to the question. These are kind of my final slides right here, which are just more stories. So I see that there are 2 comments in the chat. I have advocated for change on a small scale for my child. For example, getting his IEP to be quite different than expected. How can I effectively advocate on a different scale? School district, state, national level, is one more efficient? What about when my personal views are not exactly aligned with an advocacy organization? Are direct letters to state senators the best thing to do? Well, I think I've sort of hit on some of that in what I just addressed. It kind of depends on the issue. You know, for me, I considered kind of fighting through the IEP process to get my son's ABA. But I really, for us, I felt strongly that the schools were trying and the insurance companies were not trying to help at all. They were trying to stay away from it. And I thought, sure, I could hire a lawyer to sue the school district. That will take years probably and cost a lot of money. In the same amount of time, I can probably change the law, the insurance law at the state level, and then everybody or more people would be able to benefit. So it just depends on exactly what is the policy change that you want to effect. Direct letters to state senators and representatives are a great thing, and direct meetings are even a better thing. As I said, you want to put a face with a name so that they know. If I tell you, like, legislators in South Carolina, if a constituent ever contacts them about an autism issue, a lot of the legislators will reach out to me and say, can you help me help my constituent? And I am so happy to do that. I love that they reach out to me, but they think of me as the autism mom, and there are others as well. And because I've made my face known to them, and they know that this is something I'm very passionate about. So make yourself known to your legislators so that should they ever have a SynGAP issue arise or other rare disease issues, they'll reach out to you for help. Are there any other questions? I think a lot of this maybe is through Facebook Live, so I don't know that I would see it, but.
Yeah, no worries. I actually have a couple of questions for you myself, but I just wanted to say all of the information that you've given us today has just been so incredibly comprehensive. I love how much of it comes, I mean, really all of it comes from your personal story, and the intersection of your personal life with obviously your professional career, to make change for so many of us. And I definitely do want to ask you some questions. Some are a little more general, and then some are a little more specific based on conversations that I've had with people prior to this webinar and knowing what they would want to ask as well. So my first question for you is, you touched a little bit on how we should view legislators. So for instance, the basic takeaway that I got was that we should view them as wanting to help, but perhaps not being informed. Mm-hmm. I want to ask, after all of this time, what would you say is the general way that we should view insurance companies? At best, what are they? And at worst, what are they?
Woo, that is a loaded question. Well, my experience was that insurance companies were not going to step up to the plate voluntarily and do the right thing. I wish that were not so, but if you think about insurance companies, they answer to their shareholders, and their shareholders' interest is to maximize profits, essentially, at base. I mean, I'm oversimplifying, but it is not consistent with maximizing profits generally to add benefits. The fewer coverages they have to offer, the higher the profits will be. And so I have not had a lot of luck reaching out to insurance companies directly to try to get them to add coverage. That said, once coverage was mandated, I have some really great relationships now with people who work within the insurance companies, but their lobbying arm is a different matter, and we always fought rather tooth and nail. Now, all that said, given the similarities between SynGAP and autism, if I were your community, I would give it a shot. You know, the prevalence is low, relatively low, and given the similarity, I think it would be worth reaching out to each insurance company to say, you know, we're very similar to autism. We respond very similarly to autism. There's now a lot of cost data to show that adding the autism ABA coverage did not break the bank. It was remarkably low, the impact on premiums. In my state, for example, years after the insurance mandate went into effect, we have data from Blue Cross showing that the impact on premiums is about 40 cents per member per month. And so really, do they want to fight with you that much over that little? So I think it's worth a shot.
Yeah, that's actually striking to me because I've never never had it put to me, you know, when you add an expensive therapy that looks incredibly expensive to a single family, right? When you're
Yes.
looking at $100,000 a year, but then when it's shared within a large insurance network, what that actually looks like. Is there a great place that we could go that has numbers like that to look at the cost benefit or the actual, I guess, negative cost of 40 cents that the ABA could have on a plan?
So email me. I have a lot of that data. I'm not sure that it's publicly available anywhere. Well, that's not true. I'm not sure it's broken down in a way that you would be able to access it, but any state's public employee health plan would, of course, have to make their data publicly available. It might be a little more difficult to extract just that piece of it, but I have a lot of it, and I'm of course very happy to share it with you. I will also say that as to the autism benefit in particular, for a number of years, the Missouri Department of Insurance was required by their state legislature to report on the cost of the autism coverage. And so that is one state's data that is publicly available, written into a nice document. I can also send you that latest report, but you could Google that and find that as well.
Great, that'd be really interesting to see. So just on the topic um, of SynGAP, and obviously I had mentioned that the prevalence is about 50% of our kids will also get a co-diagnosis of autism. You had mentioned, and I'm so sorry, I didn't write down the terminology that you used, but I think it was something along the lines of we could kind of be tacked on with the autism legislature as SynGAP. I just wanted you to give me like a brief overview of what you meant by that and kind of the steps that we would look at taking if we wanted SynGAP to be recognized as a disease that's worthy of having ABA provision made for our loved ones as well.
So I think it would require legislation on a state-by-state basis. But rather than having to write a whole bill from scratch, what you would do is pull up the existing autism insurance law and just add the words "and SynGAP" when it defines for whom must this coverage be available. You would just add into there "and SynGAP." And so it's a tiny change, which can make it easier to go through. The Down syndrome community got added to the autism insurance mandate in Florida. In Missouri 2 years ago, another group of disability advocates got the mandate expanded to cover another group of disabilities. Now, that experience was actually highly problematic because that group of advocates kind of didn't know to touch base with the autism community to make sure that they weren't agreeing to anything that would be damaging to us. And so the insurance industry got a hold of their bill. I mean, initially all they wanted to do was add their group of disabilities to the coverage bill. The insurance industry sat down with them and said, you know, maybe we can work with you so you won't have to fight so hard to get this added. We'll agree to have your disorders added if you'll agree to a few language changes here and there. Language changes which were highly detrimental to the autism community, but they didn't really know that. And so the autism community had to spring into action. We didn't even know about the bill until it was already halfway through the entire process and had already passed the House. So it can be problematic. Anytime a piece of a law is opened up, it can be problematic. And so we're always having to protect the 50 laws that have passed. But I can assure you that the autism community would be very supportive of the SynGAP community just trying to get added in, and we would help.
Okay. What do you think we should have in mind as far as strategy goes? Because I'm sure you're aware that SynGAP is, just one of many neurodevelopmental disorders that is, linked with autism and tied to a genetic diagnosis. Would it be in our best interest to levy relationships with those other organizations to get a bunch of them included? Or would it be better to say, well, let's just do one at a time, because then it, maybe is less complicated in some ways, and do it just for SynGAP? What do you think?
Yeah, that's a hard question, and it might vary from state to state. Or it's possible. Some of the autism insurance mandates actually say there must be coverage for autism and similar related developmental disabilities or other neurological disorders. I don't remember the exact language, but some of them are very specific to autism and others are slightly broader. And certainly I'd be in favor of making it as broad as we can. But sometimes when you try to use language that's a little too broad or generic, that just gives the insurance industry a reason to fight back and say, well, I don't even know what they mean by this. Which disorders have to be covered? Can we count those? Do we know how many people that is? So it can be a little tougher. And, I will say the autism community at times got criticized for pursuing coverage for only autism. But I'll tell you, I wrote the bill. That's all I knew, right? I mean, it's not like we were trying to be exclusive or that we had made a strategic decision that it would be easier to pass just autism. I only was advocating for what I knew. And I knew that ABA had been shown to be effective for autism. So, you just have to kind of balance going beyond where the science is valid or whatever, and make that kind of on a state-by-state basis.
Okay, yeah. Now, the next question that I have for you is a little more, it's not focused specifically on autism, so you can let me know if it's, maybe not your expertise, but I'd still love to get your opinion. So, as you know, with SynGAP, we have children who we want treated with ABA because of their autism diagnoses, and that's expensive. And on the other hand, a lot of our children are diagnosed with epilepsy and other comorbidities that we also are seeking expensive treatments in the form of some kind of genetic treatment. And other neurodevelopmental diseases have already had such treatments come down the pipeline in clinical trials. We're of course hopeful that that will happen for our disease as well. I'm wondering what knowledge you think you could transfer to us as a group that will also be seeking expensive treatments in the future in the form of genetic treatments, and making sure that our loved ones have access to those as well.
Mm-hmm. So in the case of other genetic disorders for whom treatments have been discovered or however you want to put it, has there been difficulty of getting coverage for those?
So I'm not super aware of what's gone in this realm as far as coverage. I do know, as one example, muscular dystrophy has a genetic treatment that is covered, at least in some cases that I've personal family stories that I've read, covered by their insurance. I'm not sure what legal battles, if any, went into that. I wasn't sure if you might be able to speak to that.
Yeah, I mean, I don't really know. I my initial reaction is, make sure that there's not already coverage. You may not be getting, so with autism, because there is no identified genetic underpinning, that is one of the reasons the insurance companies didn't want to cover it, or that was one of the justifications they would give legislators, is we don't even know what this is. Anybody can say they have autism, there's no medical test for it. And so in a way you have a leg up because there's an identifiable genetic cause. And it's not the case that everything that is coverable is listed in a policy as covered. So, I mean, I'd say the first thing to do is file claims and see if it is covered. And if it's not, figure out what is the reason it's not, because often the reasons are junk. You'll get invalid reasons, or, I don't know. I think sometimes the insurance companies just throw something to the wall and see what sticks. They just issue a denial and hope that the family won't appeal. And most of the times the families don't appeal. They just say, oh, that got denied. Ugh. And they don't think to fight back, and they don't think to question, why was it denied? So I would definitely very exhaustively go through that process first of seeing if they will cover it, and if they won't, what is the reason and is it valid?
Okay, all right. And then my final question to you is, if you have any advice for maybe some of our global SynGAP family that are residing in countries where, ABA is still going to be told to them that it's experimental, and, we don't cover this, like nothing in our nation covers this. What would be some first steps that they could dream of looking at? Obviously, the system is not going to be exactly the same here as in the States, but I'm sure there are starting places for them.
Yeah, I appreciate that question. And I lose sleep now over that question. I've worked with families in a lot of different countries. I've traveled to many of the countries to meet with their legislators or their Ministry of Education or their Ministry of Health to advocate for ABA coverage. And it's a long process. You've got to find families who are in it for the long haul, and it may be resolved too late to be of maximum help to your child. But if you think of future generations, because in many of these countries, I remember going to the Czech Republic, and we had great meetings with the legislature, with the relevant ministries, about the reasons to require coverage for ABA. But there were no behavior analysts, and there were no training programs for behavior analysts. And it's like, where do you even start? And so those families started by getting one of the universities to add a training program with the appropriate course sequence to churn out some BCBAs, who then could open some clinics, and then we could get funding for it. So it's a long multi-year process, but it's going to take the families pushing to make it happen.
Yeah.
And CASP will help with that. The people who kind of led the effort in the United States are more than happy to help around the world, and we're really invested in just making sure every child has access, no matter where they're located. So yes, even though the system's different, I did some speaking in various Asian countries, and in Northern Ireland, and just a handful of countries around the world, in Brazil. And yeah, you don't get a legislator to file a bill in the exact same way, but some of the concepts are definitely the same. And just know that we're willing to reach out and help to provide resources, to share our experiences, to share the cost data, that sort of thing. and even to travel where we can to help convince your policymakers.
Okay, so for instance, a country that I know well, South Africa, they're in the situation where autism providers are available if you have enough money, because they're very much located in special schools that cost, you know, tens of thousands of dollars a year for your child to attend. Would that be the kind of situation where, and I'm assuming this is the case for other countries as well, where they would see legislation as their next step since providers are available?
Yes, absolutely. And in fact, I've had conversations with a few South African families, and was on the cusp of one of the families was I think ready to fly me over, and then COVID hit. But I think South Africa would be it'd be a great country to work on, because they do have some infrastructure and a system of government that I think would support this. So yes is the answer to your question.
Okay, I really appreciate you answering it too, because I know one of our moms who's very active and from South America is here. And this is a conversation that we have a lot about, making sure that families have access to the care that they need. So
great. Well, my husband and I both, my husband also works in this field. He runs a company called the Autism Legal Resource Center, and that's essentially his law practice. But all he does is work with autism families and providers to try to get adequate access to care all over the country and all over the world. And so he and I both went to Brazil in 2019, right before the pandemic, and we're still in touch with quite a few of those families, because in particular their court system, the litigation that's ongoing is very similar to some of the ways we have handled matters here. And really our experiences there were quite relevant to them, and we're just happy to share, you know, what we've learned.
awesome. Well, Lorri, I want to tell you just again how incredibly grateful we are that you took time out of a busy schedule and so many things that you do to chat with us. I really do feel inspired by your personal testimony of caring for your son, and then, you know, making a purposeful decision that you were going to do things in a way that would change things for future generations and hopefully around the world as well. So again, thank you so much for taking time to chat with us. And if you're open to it, for those families who are maybe watching the recording later on, I'd love to submit any questions to them if you're open to that as well.
Of course, I'd be happy to. And I'm just very appreciative of the invitation. I have learned a lot by meeting you all, and you know, anything that we and the rest of the community can do to assist the SynGAP community. We feel your pain in a lot of ways, and we want to see this inequity righted, and we're happy to help.
Great, thanks so much. I really appreciate it. All right, so I'll say thank you to all of those who have been watching us and following along. If you do have any questions that you'd like to have submitted to Lorri, then you're welcome to send them through to me, Sydney@syngapresearchfund.org. And again, thanks, Lorri.
Thank you, Sydney.